Hello, I'm Anita and this is Care Experts, brought to you by CareCredit. With the CareCredit credit card, you can get the dental work you want or need now. CareCredit is accepted at hundreds of thousands of locations nationwide for preventative, restorative, and cosmetic dentistry. Today we're in Los Angeles, California with Dr. Mori. Born in Brazil, Dr. Mori is a member of the American Dental Association and has over 30 years of experience. She practices in the heart of Beverly Hills and focuses on compassionate dental care. Today we'll be talking about root canals. So Dr. Mori, can you explain to me what exactly is a root canal?
Root canal is the treatment of the infected pulp, nerve tissue, blood vessels, and other cellular entities that are inside your tooth. So the tooth has like layers, so the enamel, the dentin, and then the nerve. So the nerve is, when you do a root canal, this nerve got infected by bacteria.
So how would a patient know that they need a root canal?
So when you need a root canal, you're gonna have a lot of pain.
Okay.
Usually, it's not like, oh, I think I need a root canal, my tooth is hurting. It's not like that. It's a very, very distinct pain. It's almost like a throbbing, like your heart's beating inside your tooth. Wow. And it started by a simple caries, a simple decay, but you neglected. You didn't go to the dentist. That decay started getting bigger. It went from the enamel to the dentin. Now it's in your nerve. And there's no way around it. You cannot cure that at home. So you need to go to your dentist and have a root canal.
So this is something that develops over time. You're not just gonna wake up one day and all of a sudden need a root canal.
No, unless you fell down and you hit your tooth and the nerve died.
Ah.
So you're not gonna be in a lot of pain, but you're gonna see signs of your tooth getting darker. Okay. Especially with kids, you know, in the summertime, they fall in the pool and they hit their tooth. They're not gonna be in a lot of pain. But let's say after a few days, a few weeks, you start noticing a little change in color. That means the nerve died.
So if a patient did need a root canal, how would they prepare for this procedure?
The procedure is not much, preparation, doesn't need a lot of preparation. You go to your dentist, you're gonna get numb, and they're gonna just clean the inside of your tooth. It's like a very finesse little needles that goes inside and removes this dead tissue, which is the nerve.
And how long does this procedure take? You said just it's like an in and out, or are they?
Usually it takes an hour. Okay. If the tooth is really infected, let's say there's a lot of gram-negative bacteria and you can see it's like almost like, pus coming out of your tooth. Then you need to wait a week and you have to come back and do one more visit. They cannot close the same day.
So are root canals painful? I know I've heard that they can be very painful procedures.
Root canal has a bad rap. It used to be very painful in the past. And I believe because the technology wasn't there, they didn't have specific little files that goes in. Nowadays, it's not painful at all. You're gonna be numb. They have this, microscopic needles that goes in there, removes the nerve. So it's much, much easy. And people shouldn't be afraid of root canals anymore.
And what is the recovery like exactly?
There's no downtime. You can go about your day. You can go back to work the same day. There's no being swollen or like an extraction. So there's really no downtime for a root canal.
Thank you so much, Dr. Mori. We'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion on root canals. And are there any risks or complications from this procedure?
There are always complications to anything we do in life, right? So a root canal complication, it's not like life or death. It could be like a broken file or the canal is calcified and the dentists have a hard time getting all the way in. But it shouldn't be a problem.
Now, would you always need a crown after a root canal procedure?
Yes, especially if it's a molar, a back tooth. Because when they do the root canal, they remove the blood supply to the tooth. So it becomes like a brittle, a dead tree. So you need to put a crown to protect the surface and all the structures, especially if it's a molar, because you use your back teeth to chew hard foods. Let's say if it's a front tooth, like a central, and they do a tiny little opening from behind, you don't need to put a crown. So it depends which tooth, but always in the back molars, you will need a crown.
Okay. And what are some things that patients can do to prevent ever having to have a root canal?
The best prevention is to go to your dentist regularly because a small cavity can be taken care of with a simple filling. But if you don't go for checkups, if you just neglect, you're going to need a root canal. And a root canal, you need a crown, and that's much more costly.
So just taking good care of your teeth, brushing your teeth, flossing, going to your dentist often.
Yes, I highly recommend that.
Now, are root canals, is this procedure a very costly procedure?
It is a very costly procedure. It can cost between $1,500 to $3,500 per tooth, depending which tooth you're doing. Because the molars have 3 roots, so they're more expensive. A central has only 1 root, so 1 canal, less expensive. But nonetheless, it can be very costly.
Are root canals generally covered under regular dental insurance?
Root canals are covered under insurance, but it depends on insurance, the amount, the percentage that they will pay. It can be very costly. For instance, a molar root canal plus a crown and can be on the $5,000 or more.
Wow.
So we like to offer CareCredit because they can pay over time and take care of their dental needs because you can't wait.
Dr. Mori, I'm curious, if you had to say one thing that's your favorite about your job, what would it be?
The favorite part about my job is when the patients smile and they can be like themselves again and restore their self-esteem. It's really important. I have so many patients that tell me, after you did my teeth, I got a new job, or after I got my smile done, I got engaged, or I found a boyfriend, a girlfriend. So it's really rewarding to me to hear that.
Yeah, that's so wonderful. That must be because you're just giving people confidence and making them pain-free, and I'm sure they're stepping every day into their lives feeling really confident about themselves.
Yes, it is very rewarding.
Thank you so much for joining us here today and just giving us so much more information about root canals.
Thank you.
Thanks for watching. All of our featured care experts accept and recommend the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. For more information, visit carecredit.com.